Classification of patients in first aid. This is the most important part of first aid. As soon as an incident comes to your attention, you can endanger yourself by stopping there.
Stop!
Keep an eye on the hazardous conditions at that location. Only go to it if you really know that you are in no danger. Only remove that danger if you can. If it cannot be removed, seek help from a suitable person. If you are certain that an accident is not possible, go to the patient immediately. Next, we have the patient rescue process. Rescue the patient to avoid potential dangers to you or those around you. Plan early action to call for appropriate aid. Take the patient to safe place. Next, check the patient's response. Use the following keywords to check responses. A, V, P. A, alert. V, voice. P, pain. If the AVP is in good condition, it can be concluded that the patient is conscious. Check from head to toe to see if there is a fracture or bleeding. If there is bleeding or fracture, please provide appropriate first aid. The basic judgment is the steps we have so far followed. Next, prepare for secondary survey. Use the following keywords. SAMPLE sample. S. Signs and symptoms that show up at this time. A. Finding out his age and allergic history. M. Whether he is using drugs. P. He had previous medical conditions. L. The last meal and time it was taken. E. What he was doing when he got sick. Then take the patient to the hospital safely. If AVP is unhappy, he is unconscious. Check the way of breathing. You can also check the patient's breathing by look, listen and feel. A good breathing can be considered if the breathing is more than 10 times a minute. Turn the patient into a safe posture. Then take the patient to the hospital safely. If the breathing is less than 10 times per minute, check the pulse and immediately start the CPR. Give chest compression a speed of 100 to 120 per minute. Give 2 breaths every 30 chest compressions. Continue delivering until the patient is taken to the hospital or until the first aid provider or ambulance arrives.
All the steps we have talked about so far can be summarized as follows. At the end, such a short note can be made.
For more information, contact our channel Emergency Response Team.